Collecting a saliva sample is a rather simple procedure and should take you no more than a few minutes to complete. To ensure the accuracy of your test, make sure to review the collection chart on the instructions that came with your test to determine when you collect your sample. Men and children can collect on any day of the month, and women will need to determine test days based upon their menstrual cycle if they are testing hormones. Women testing only cortisol may do so on any day of the month. Please refer to the special instructions on the included sheet if you are currently using hormone treatments. Hormone users need to plan their supplementation doses for certain tests. Avoid anti-aging and anti-wrinkle facial creams for 3 days prior to testing, as they may contain undisclosed hormones. Here are the key steps to a good collection. First, wash your hands with soap and dry them with a clean towel prior to handling the contents of the kit. Next, lay out the materials that came in your test kit. Note that not all tests require the use of 4 tubes. Unless you are testing for AM/PM cortisol or 4-point cortisol, you will only need to use the 1 large tube for morning collection. If you are testing the cortisol awakening response, you will need 6 tubes. Refer to the instructions in the cortisol awakening response kit for details. You need only use the number of tubes for your specific test. Unused tubes may be recycled. Print your name, date, and time of collection on the tube. Wash and dry your hands again. Rinse your mouth with water and wait 5 minutes before collecting. Allow saliva to collect in your mouth for several minutes without swallowing. Once enough saliva has collected, gently spit it into the collection tube and continue with this process until the tube is at least half full of liquid saliva with no bubbles. Be sure to set aside enough time for your saliva collection. It may take 10 to 20 minutes to collect your sample. When completed, cap the tube tightly and place it back into the plastic bag. If your kit came with an absorbent pouch, make sure to keep it in the bag. Finally, you'll need to complete all sections of the test requisition and sign your form. Be sure to include the collection time and date, as well as your date of birth. It is important to indicate any current hormones or supplements on your requisition form. If you are unsure of the dosage, please consult with your physician or pharmacist. Premenopausal women, please remember to include the first day of your last menses in Section 2. Place the plastic bag containing your saliva collection tubes and the completed test requisition form back inside the test kit. Snap the lid shut. Place the entire test kit inside the return packaging. Attach the provided prepaid label or other postage if required, and then return using the appropriate carrier. There are several times when saliva testing is not appropriate, and you may want to consider a blood spot test instead. If you are testing a hormone for which you are using an oral troche or sublingual drops, hormone from the treatment will get into the saliva so that saliva hormone levels will be falsely elevated and not be a true measure of your own hormone levels. Or if you are just unable to collect enough saliva for the test, which is common with some medications or medical conditions. If either is the case, please talk to your provider about blood spot testing. If you have any questions regarding your collection, please call or email our customer service department.